Good evening, guys. This evening's topic A is cryosurgery, a medical procedure that uses extreme cold via liquid nitrogen or argon gas to destroy abnormal tissue, including cancer cells. Here are the key points. Types of cryosurgery. External cryosurgery. A cryogen is applied to the skin using a cotton swab or spray, freezing abnormal cells, which later scab and fall off. Internal cryosurgery. A cryo probe is inserted through an incision to freeze tumors or abnormal tissue, often guided by imaging techniques like ultrasound or MRI for precision. Conditions treated. Used externally for skin conditions such as skin tags and skin cancer. Applied internationally internally for certain early stage cancers, including prostate cancer and non-small cell lung cancer. The procedure ensures targeted treatment while minimizing damage to surrounding healthy tissue. Let me know if you want more details on a specific aspect. Absolutely, cryosurgery is a medical technique that uses extreme cold to destroy abnormal tissues, including cancer cells. Here's a deeper look at how it works. Application of a cryogen. The procedure uses liquid nitrogen or argon gas to achieve temperatures low enough to freeze and kill unwanted tissue. When applied externally on the skin, the cryogen is sprayed or applied with a swab, causing cells to freeze, die, and later shed. For external use, a cryoprobe is for internal use. A cryoprobe is inserted through a small incision and directed to the tumor affected area. Cellular damage process. The extreme cold forms ice crystals inside cells, puncturing their membranes and leading to cell death. Blood flow to the frozen tissue stops, preventing oxygen and nutrients from reaching the area. As the frozen cells thaw, they rupture and trigger an immune response, clearing out the dead tissue. Guided precision. When used internally, doctors guide the cryoprobe using ultrasound or MRI, ensuring that only abnormal tissues is targeted. This precision minimizes damage to surrounding healthy tissue, recovering and healing. After external cryosurgery is treated, the skin scabs over and falls off within days or weeks. Internal cryosurgery may require multiple sessions, and patients typically experience swelling and soreness during recovery. Cryosurgery is particularly effective for skin conditions, early stage cancers, like prostate. Cryosurgery is generally a minimal invasive procedure, but like any possible side effects, is what you can expect. Common side effect: pain and swelling. The treated area may become red, swollen, or sore as it heals. Blistering and scabbing. External cryosurgery often causes blisters that later turn into scabs and fall off. Then you've got temporary numbness. If nerves are affected, patients may experience temporary numbness or tingling. Potential risks: scarring and skin discoloration, Sometimes the treated skin becomes larger or lighter or darker than the surrounding area. Tissue damage. If the freezing process affects health tissue, okay, tissue damage. If the freezing process affects healthy tissue, healing may take longer. Loss of function. In rare cases, if the nerve or muscle tissue is impacted, minor movement or sensory changes may occur. Okay, infection uh, through uncommon, though uncommon, these a slight risk of infection at the treatment site. Internal cryosurgery risk. Damage to nearby organs when treated. Internal tumors. Extreme cold could affect surrounded organs, requiring careful imaging. Post-treatment side effects. Some patients may experience cramping, bleeding, or temporary urinary issues, depending on treatment area. Okay, most side effects involve in their own as the body repairs itself. Would you like more details on recovery and aftercare? Okay, pancreas growth. Would you like insights on its success rather than risk? Okay, cryosurgery is highly effective for certain conditions, but its success depends on the type of tissue being treated and the availability of other treatment options. Here's how it compares. Effectiveness by condition. Skin conditions, warts, skin cancer, uh, acne, keratosis. Very effective with high success rate and minimal recovery time compared to surgical incision. It's less invasive, but may need multiple sessions. Okay. Compared to surgical uh, ex- excisions, it's less invasive, but may need multiple sessions to fully clear the abnormal cells. Give me 1 second, guys. Works best for localized tumor. Effectiveness depends on precise targeting using imaging or MRI ultrasounds. Compared to radiation or surgery, cryotherapy causes fewer long-term effects, but may not be as effective for advanced stage cancer. Okay, guys, so that's it for tonight for show. I'll be on tomorrow. For now, Gator Wellness. Take care, folks.